Medigold Health are a family-run independent occupational health organisation. We were founded in 1998 by Dr. Mike Goldsmith, and Mike is a senior occupational health physician and very much exhibits the feel that we want to get throughout the industry, that above all quality in the provision that we provide to both the public and private sector. We're an innovative business spread across the UK. We have over 60 clinics around the UK, servicing both SME and some very large public and private sector clients such as the BBC and Morrison's. We also have a large fleet of mobile surveillance units and station our clinicians on client sites to deliver employee screening, both on a health and wellbeing basis and guided through guidance under HSE legislation. Amongst our core OH provision of sickness absence support and health surveillance screening, we also specialise in rehabilitation services such as physiotherapy and counselling, employee assistance programmes, an absence management service supporting employers with early intervention for individuals that would be off sick for various reasons, both medical and non-medical. First and foremost, we're a consultancy, and we pride ourselves in having a close relationship with our clients to really understand their business, their requirements from a core OH provision, and what they can do to future-proof their organisation, improve retention, be a more attractive employer, reduce absence within the organisation, and invest ultimately in their employees' health and well-being at work.
Well, we wanted to come along because this conference was specifically about mental health. And for our clients, mental health is just an enormous issue. A very costly issue, a very risky issue in terms of the cost of absence, poor performance, the loss of key staff, the inability to attract talent. So our clients are really interested in mental health, and we wanted to be here to talk about our services and the range of things that we can do to help mental health at work, covering areas around prevention, monitoring it, signs, indicators, picking up problems early, so early identification would be a key. And also in terms of response, and we have some excellent responsive services around managing health, mental health, and particularly around managing absence. So because of the topic and because of the audience, it was a great thing for us to be here today.
Well, I mean, for myself specifically, sort of conversations around absence management, because there was a lot of high-level discussions today around mental health, whereas I like to kind of look at the more practicalities of managing employees, employee health and well-being, and absence management. So kind of taking the stress and strain off these large organisations' employees, so that stress does actually reduce and absence reduces, and just conversations around that really, and some quite interesting ones with some of the larger public sector, NHS and councils.
Yeah, if I could add to that, I've had some great conversations today, both in terms of people who are interested in the services that we potentially could provide for them, but also for organisations that offer complementary services where there's opportunities to collaborate and partner with those organisations to offer our clients a better service. I think they're incredibly important. You know, there's only so much. I mean, obviously you can read stuff on a website or, you know, on an email, or you could download stuff, but there's no real substitute for actually meeting people, having the opportunity to ask them questions. It's a great learning opportunity. Also, it's a fantastic networking opportunity. You can meet prospective collaborators, partners, potential customers, and also you've got a great opportunity to learn from other people in the field. So for all those reasons, I think you know, it's been a great conference, and it's a great idea to hold such an event.
I think if I can add to that, specifically the topic of mental health, it's something that we're very much in the early stages of thoroughly understanding, really, as you know, as a nation, really, and the events such as today's really allow us to educate each other, so build awareness, educate each other in different tools and resources that are available to you know, various different industries, learn from different practices, and move towards, you know, hopefully a solution of you know, a better understanding of issues around mental health in the workplace. So it's a really informative event and a good opportunity to educate.
Well, for me, it was the conversations I had with people. I mean, it was great, obviously, to have an opportunity to speak and to share a platform with Nick and talk to people. But probably the one-to-one conversations were the best, because then you can really get involved in discussing the issues and seeing if there's areas where you can collaborate. And obviously it gives you opportunities then to follow up with people afterwards. And from a business point of view, that's great for us to do that.
Yeah, and for me, it's interesting to kind of, I sat in on some of the sort of higher level discussions around mental health, but I always like to get into the practicalities of things, and what you can actually take away from these type of conferences in terms of actually putting solutions in place to help reduce mental health issues and actually improve well-being of individuals. So it's good to see the other aspects of that and what people are working on currently.
The standout thing for me was you know, everyone here for a common interest, and everyone you spoke to, they're invested in the same thing. They want to improve mental health, you know, in the social setting, in the workplace, and it was really, yeah, it really stood out how, you know, we're a strong force when we're all together, and it's a really, really great format to sort of share ideas as well.